Hey everyone, my name is Damaris and I am the CEO and co-founder of Edney Nursing Tutoring. Today we're going to be going over two drugs that get commonly confused in the NCLEX, but they're completely different. You have hydralazine and hydroxyzine. The way I remember the difference is I look for the XYZ in hydroxyzine and the A in hydralazine. A for vasodilator, XYZ antihistamine. XYZ rhymes. Maybe not so much the hydralazine, but at least it helps you to remember that vasodilator has an A in it, right? So compare the A to the A and the XYZ with the mean, all right? So what are we using these drugs for? With hydralazine, these clients have what we call hypertensive issues going on with them, okay? So we want to treat that blood pressure. It's an antihypertensive. It helps to relax those arterial smooth muscles so that systemic vascular resistance is ultimately reduced, because when you reduce systemic vascular resistance, you are able to have a lower blood pressure, right? That helps to reduce damage to the blood vessels. Side effects include headache, tachycardia, nausea, dizziness, and palpitations. One of the biggest adverse effects, and sometimes the NCLEX loves to ask about this, is that they can develop what we call drug-induced lupus. Long-term use usually causes this. So you need to caution your clients when you're educating them about hydralazine that if they use it for too long, they need to look for signs and symptoms of lupus. Some of the other adverse effects include severe hypotension, reflex tachycardia, because again, your body is vasodilating, so your heart thinks it needs to compensate, so it's going to get faster. All right. Chest pain, numbness, tingling, mood changes. If your client complains about chest pain or they're already tachycardic, you probably want to be on the side of caution with this med. But the main contraindication is CAD, mitral valve rheumatic disease, and you want to be very cautious in heart failure. For hydroxyzine, this is an H1 receptor blocker, which is a type of antihistamine. So it does help with pruritus and allergic reactions, but the other thing that it does is that it affects your CNS. Therefore, you can develop sedative and anticholinergic effects. So you want to look out for drowsiness, dry mouth, dizziness, and confusion, because again, it's affecting not just that periphery, but that CNS. Biggest adverse effect that the NCLEX is always going to test you on is about that QT prolongation. If they have prolonged QT interval, you are not going to give this medication to this client. But you're also going to be monitoring them for QT prolongation if they don't have a prolonged QT interval. So you want to put them on a cardiac monitor and ensure that their heart is okay, because the longer that QT gets, their heart can stop. They could also develop seizures and CNS depression because, again, it is affecting that CNS. I hope this was helpful. I hope you guys learned a lot. Subscribe, like, share, put comments, and let us know if this was helpful. Thank you guys again, and have a blessed day.